Stockton Simulation Suite here at Stockton University, and have a little presentation I want to share with you. What I do here is basically I coordinate all the simulations here at Stockton University. And if you're not familiar with what simulations is, but basically we do what we call healthcare simulations, and we're focused on helping to improve performance standards for our healthcare professional students. So I'm currently working with nursing, physical therapy, occupational therapy, our speech and hearing communications, as well as our social workers. And the reason why we do simulations is to prepare students who are actually going into the healthcare field careers and prepare them for those fields by actually doing um, practice simulations before they actually go on out into the field. So basically, um, do everything that we want to do here in the simulation suites as you would perform out in the hospitals or the clinical setting. There's some advantages to that because literally we're not throwing anybody into the hot water as per se into a hospital environment or into a clinical environment without actually having some exposures to actually working with and being around with simulated patients, rather they be mannequins like this one here, or our actors and actresses that we hire and work with our students. So I'm going to take you to a brief little tour of our simulation suite here. That's what kind of reduces here for a second there. Okay, so here we actually have our modern facility at this time, and we actually have a very large suite here. We actually have two conference rooms, and we use these conference rooms to actually put students in so they actually perform case studies and as well as other simulations. So basically, when we talk about what is healthcare simulations, well, we healthcare simulations could be a lot of different types of methods on actually do how to do simulations. But in general, it's basically an alternative to actually from working with real patients, and we actually do it in a safe, convenient manner for the students to thrive in, and that's one of the most important parts here. That everyone is kept safe, and a lot of it judgment free. So you're free to make errors without harming anybody. And that's one of the big things we do about simulations. So we actually have several different types of simulations. One is what we call standardized patients. And what a standardized patient is that patient actor and what I spoke earlier about. And we hire them to actually role play a patient for the student to work on. Now, there's advantages to that. The students are actually working with somebody, generally someone close to their own peers, but that person is also a actor or actress working as a patient. So the advantage is that that person will be able to give immediate feedback to the students of what they feel and what they're comfortable with and what they weren't comfortable with, as well as the feedback from the student getting from the instructor as well. So this is one of our standardized patient rooms that we have here, and everything in our rooms that we have here are live. When I say live, they're real, so they're not mock-ups, they're not dummies or anything. Too, everything that we have in our simulation rooms are real as far as the equipment goes. So we have monitors, we have cameras that actually will record all the movements and everything that the student will be doing inside of a room. And we have the opportunity to actually play it back for that student so they can see their own performance and they can actually comment on their mistakes. And also, we like to pretty much not just talk about their mistakes, but a lot of the things that the student has done well during the simulation session. So in this room here, we have two rooms that are the exact same, and they are used for our patient assessments. And again, videotaped, and the student can go in at any time and come into the simulation suite and review everything that they performed during that course of a day. Now, during the course of a day, we actually will put in, may have anywhere between 17 to about 30 students that will come through the simulation suite per session, but it's not going to be crowded. Everybody comes in at a certain time frame. They do their particular case, which can last about 5 minutes to about 25 to 30 minutes, again, depending upon the case. This is one of our simulation suites with one of our other mannequins. The mannequin that you see laying in the bed has the ability for the person to check their blood pressure, the pulse rate, um, listen to lung sounds. Um, Also, you'll be able to listen to bowel sounds and different heart sounds as well. This mannequin does also have a very limited vocabulary. And one of the things that you'll find in this particular suite is, again, everything is live. We have oxygen, a suction unit, IV poles. In fact, this mannequin's able to take IVs. In fact, this mannequin's also is able to actually retain fluids. So let's say if you're a nursing student and you're trying to put a catheter in for a patient to for urination purposes, well, you can actually put the catheter in, hit the bladder, and fluid will be able to come out. So you'll know if it's successful or not. So this is a very important tool for many of our healthcare career education folks. We actually have a simulated patient hospital room as well. This is another one. So in this room here is basically the same thing as the last room I just showed you. And in this room, again, we actually have a nurse cart, a drug cart in which nurses will be able to go in and pull out their drugs, the simulated drugs, to give to the patients. Again, the same exact way in which will be conducted in a hospital or clinical environment. And this is a view to the rest of the room, the station, the instructor station, as well as with the monitor. And one of the things that we do when we're doing our simulations is that we will actually bring a shade down over these windows so that the student doesn't feel as though that they're like in a fishbowl where someone's actually kind of looking over their shoulder. So one of the things that we will do is bring the curtains down and give that privacy for that student to work in. Again, one thing we don't want to do is make that person feel very, very nervous when working when working with the patient. They're already nervous enough going into a room and being evaluated. Let's not just add the extra nerves by having someone look over their shoulder when we actually give them their privacy. And as I said before, we have cameras in the room, and so we'll be able to follow the movements of the student and even listen to what they're saying through the audio visual. We have another room. This is our intensive care unit room, which is pretty much down the hall from this last room. And this room looks pretty dramatic. I have it set up where you actually have a vent on your patient. Again, everything in this room is live. So we have a ventilation unit. We have a monitor that's in the background, suction units, oxygen and air, and anything else that we want to put in the room for that simulated event. One of the best things about being in simulations is I can have a professor come up to me and say, hey, listen, we want to do this particular simulation for our students. Can we make it happen? And the big challenge is making it happen, making it as realistic as possible if I'm working with one of our standardized actors or versus working with one of our mannequins. Again, with this mannequin here, the student has the ability to listen to lung sounds, heart sounds, pulse, blood pressure, just like the other mannequin as well. And again, these mannequins are fully functional. The only thing that these mannequins don't do is actually breathe in and up. But I do have a mannequin that will have that chest rise and fall. So this is another view of this particular room. And as you see, it's pretty dramatic to see the ventilation unit on. And it looks just like a patient ICU room. And again, the big thing about simulation is this. let's prepare the students for what they're going to see in the hospital rather than just pushing a person in the back and saying, okay, you go into that room and go ahead, go right at it. So we want to prepare the students when doing something like this. And this is one of the ways that we could do it with. Okay. This is another room that we have. This is our labor and delivery room. And in this room, we actually have this mannequin here, and her name is Lucina. Lucina delivers babies, and so it's a whole mechanism that she will do. During our simulations of labor and delivery, certain days, she can deliver up to 5 to 6 times a day, and even more if we wanted her to. I'm sure if, as a real person, no one wants to deliver 5 to 6 times in a day. I don't think so. So with this particular mannequin, she has a lot of different functions that my other 2 mannequins don't have. For example, she has the ability to, her chest will rise and fall. She will also be able to have blinking eyes. We could change the color of her eyes to mimic any particular condition. So if she actually has renal failure or liver failure, her eyes will turn yellow. If she has maybe a head injury or brain injury or brain bleeding, we could actually make her eyes turn red. So her holographic eyes is one of the best features on her, as well as her breathing and as well as her ability to actually retain fluids and, of course, deliver a baby. So that's one just kind of show you this. So as you can see her chest will rise and fall, and she will speak as well. And her vocabulary is a lot more extensive than a lot of other. Sorry. So her vocabulary is a lot larger than the other 2 mannequins that I introduced you to earlier, and a lot functional. So her skin, although it looks more rubbery, it is pretty real. It feels pretty real. And as you see her eyes blinking, and right now we have her changing the colors of the different eyes from yellow to red. We can actually make her eyes, we actually dilate her eyes, or we can actually make her eyes constrict, or we can freeze her eyes. We can actually do a lot of different functions with Lucina to mimic any patient around, not just a patient that's pregnant. And again, like I said earlier, she can retain fluids, meaning that we can actually put IVs in her. And I'm going to come off of this. Okay. And you see, we actually have Lucy right here. And does anyone have any questions at all?
Good afternoon.
And so that's Lucy just talking there. Anybody have any questions at all for Lucina or anything regarding the simulation suite? If you want to type them in, go right ahead. If you want to go through through the chat, I'm more than happy to answer your questions with that. Or if you can just go ahead and just raise your hand and just throw the questions at me, go right ahead. So the question is, will the students in the 5-year PA program have time in the simulation suite? Well, one of the things that we will do is, in your program, you may come in to the simulation suite. One time during your program, depending on your instructors. Generally, if you're in PA school, they'll do a lot of simulations in that PA school. But if you're in being in health careers, you may be exposed to the simulation suite a few times, maybe to do vital signs, lung sounds, heart sounds, and just to prepare for it.
I'm sorry, my audio wasn't working, but I might have missed it. When do the nursing students start in the simulation lab?
Well, the nursing students start in simulation lab depends upon their instructor. But we have nursing students that come in and as freshmen to learn vital signs, um, and to even go into therapeutic communications.
Okay. Thank you.
So it may not just necessarily have to be with the mannequins. It could actually be with working with our standardized patients.
Okay.
And we have a lot of cool scenarios in which we actually develop so that the student can actually work on real life type events that occurs in the hospitals or clinics. So it's not just the regular, um, hello, my name is John. I'm here to take your vital signs. No,
Yeah.
we throw a lot of different scenarios at them.
Good.
So it's never a dull moment. So if if you're expecting to say, okay, I'm just going to go in and check vital signs. Well, we will help you. We will help you learn how to do the vital signs by working with the mannequins. But now we want you to apply it in a real life situation. Now, how would you apply it? Now, you may have somebody that could be uh, that may have a psychotic episode that you need to do vital signs on. And part of the things that you need to do is to communicate with this individual to let them know that, hey, I'm here to help you and take your vital signs. And we couple that all in within that simulation.
Great.
So if you come in here looking just to a straight vital sign, it's not going to happen.
Good.
Any other questions? How many of you are looking to go into some type of healthcare education? Physical therapy, occupational therapy? Physical therapy? Okay, good. Physical therapy comes down here. And basically, when physical therapy comes here, we do a lot of safety, a lot of lifting, moving, vital signs, and a lot of movement with our physical therapy students. Occupational therapy students as well. They come in here and they utilize the Sim Suite. And the fact is, they utilize the Sim Suite quite often. One of the big things that they come in and use Simulation Suite as far as their midterms and their finals. So they come in here even during the week of the midterms. They're here every single day, just honing on their skills, getting ready for the midterms. And generally, their midterms are going to be done here are done here in the Sim Suite. Does anyone else have any questions? Okay. Oh, you're welcome. Ashley, you're very welcome. Anybody have any other questions? Okay. Renee, you want to take it?
Yep. All right. Good afternoon, everyone. My name is Renee Cabeza. I work within the School of Health Sciences, and I work with our anatomage table, which I'm going to give you a short demonstration on now. So I'm just going to share my screen. Our anatomage table is a 3D dissection table filled with cadavers. So this is one of the cadavers within the suite. These were real life individuals at one point who donated their bodies to science, and then they stuck them in this blue gel stuff. And then they sliced them every 2 millimeters, took a bunch of pictures, put them back together, and then sliced them this way again. Put them back together and then slice them finally this way. because so all of these individuals donated their body to science. This is 100% interactive. So let me just show you some of the capabilities within the table. For example, hold on, oopsies. All right, you can bring this down. You can spin him. We'll zoom in on him. So this is used within our anatomy classes. The faculty within the School of Sciences can reserve the room, bring their classes down, or they can teach their entire class within the classroom. So right now I'm showing, let's click this again, and highlighting the veins. It's showing directional blood flow there. You can also highlight the spine. So let's say that an instructor is going over the spine one day. We're going to dissect him this way, and we can bring it all the way down to the spine. And you can see how all the different muscles and veins and arteries interact with the spine. And then if we wanted to zoom in, you can go super close. And again, all of this can be labeled. If it's a bone, you can show all the insertions and origins on the bones for the different muscles. So this is really good for our physical therapy students. Zoom out. Bring it back. And then this one is all the bony landmarks. So I'm showing all the bony landmarks for the sacrum. It could be labeled. You can change it different colors if you're doing some studying. If you wanted to, Anatomosh has created some presets on here. So we can go over, let's say we want to look over the cardiovascular system more specifically. While this is loading. The veins of the stomach and pancreas. So this is going to show you, these are all the different veins within the stomach and the pancreas. The table also houses over 2,000 MRI cases. Any questions on this?
The table, is it interchangeable? How would you see a female?
So yeah, so there's 4 cadavers. It just takes a little while to load. So there's 4 cadavers. There's a Caucasian male, a Caucasian female, an Asian male, and then an Asian female.
Okay. And can the students have access to this on off hours?
So yes, so once a student has been trained on the table, which they can get training through their instructor, we have what we call open lab. As long as the table isn't reserved for a class, they can reserve the room themselves and come in and use it to study as a tool.
Great.
Any other questions? No? All right, awesome. I think Mr. Davis left. So if you don't have any questions, any other questions on the sim lab or anything? No? All right, guys, I think we're going to end a little early. I'm going to hang around a couple minutes if you have any questions for me. If not, have an awesome day. Don't forget to check out some of our other sessions for the open house. I know there's a financial aid session and a housing session and all that good stuff.
Thank you.
Have a good one.